Now this works on anyone, young or old.
I would say if they have a good amount of platelet supply and their immune system is in pretty good shape, it pretty much works with just about anybody. We've done people as young as 9 or 10 years old to 90 years old. You can use this on children. That's the beauty of it. There's no steroids involved. If you have someone that has an injury, even at a young age, you're just using their own blood serum in a concentrated form to place it for natural healing to occur.
The other part that I find amazing, and we were talking about this earlier, is that they are your own stem cells. There is no moral issue about it.
Correct. You
don't have to get permission to use an embryonic stem cell. Do you feel that this works as well as an embryonic?
For our purposes, absolutely. I mean, certainly if you want to regenerate a new liver or something like that, then there might be some other stem cells out there. But as science evolves, we're finding that we don't need the embryonic stem cells, that the scientists are discovering ways that they can get stem cells from your skin, or they can get stem cells from the fat. There's extraction methods from the fat to get stem cells. And of course there's bone marrow stem cells, which are also good. It really depends on what body part you're trying to treat. But for the most part, bone, muscle, ligament, tendon, even heart muscle, you can use these stem cells and growth factors that we're talking about. In fact, there's a treatment out there that they're using this same tissue that we're using in some centers, in investigational purposes. They're actually injecting it into the heart to help regenerate heart muscle in people that have heart attacks or circulatory problems in the heart. They're also injecting this into arteries in the extremities for people that have, let's say, diabetes or peripheral vascular disease to help regenerate new blood vessels in the extremities. So this what we're talking about is not an alternative type of treatment. This is really cutting edge, and I think the future of medicine.
Not only that your patients, no one is, as I said before, it's local anesthetic, and no one is knocked out, and they chat with you, and
Sure.
I know you constantly ask people, are you all right? Are you all right? And they answer you, or they kid with you. There was a young lady who played the guitar and the percussion, and she hadn't been able to play in a long time.
Yeah.
And she was so excited about being able to perform again that it was fun to watch her face when she talked.
Yeah. That's what gets me through my day, actually. Having to deal with the insurance companies always is the tough part, but being able to help people and turn their life around, take away their pain and get their life back, whatever they like to do, whether they're a policeman, being able to get back to work, or whether they're a musician or a dancer or a runner, where they couldn't do what they enjoyed to do. With some of these treatments, we're actually able to erase the problem and get their life back. So that, for me, is very rewarding.
I was in a lot of pain, so I went to go get an MRI of my hip, because all I would do is limp all the time. And the doctor that I went to told me that I needed a hip yesterday, that I had bone on bone. So I called up Dr. Magaziner, and I says, could you help me out? And he says that there's this procedure that he could try. He has to see my MRI first. And if it looks good, he could probably get me 5 to 10 years before I would need a new hip. So I says I was willing to try and go see what it was like. I'm able to exercise again. I go on the treadmill. I do an elliptical cycle. I own a laundromat, and I have to jump over washing machines to get to the drains and stuff, and before I wasn't able to do that, and I'm able to do that pain-free now.
I had tendonitis in both elbows. In this one, it was on the outside, and on the right one, it was on the inside, and the pain was very severe. So I had tried everything else, and my last alternative was surgery, which I really didn't look forward to. And then I heard from a friend here in the library about Dr. Magaziner's treatment. After about 5 or 6 treatments, both elbows started feeling much better.
So what would you say your pain level was in the beginning?
My pain level, probably in one arm, in my left arm, was around 7 or 8, and in my right was like a 10.
And where did they drop to?
I feel tremendous. I can lift weights now, and I can lift my kids and play with my dog and do all the things that I used to do.
So how many treatments would the average person get, or is it case per case? What is the least number, or maybe the maximum?
The least number I would say is 4, and the maximum that we're doing in one series would be up to 7. And then after that, someone might come for maintenance once a year, for example. And if we're treating a bad arthritis of the knee or the hip, once we're able to get their pain level down to the range that they're happy with, then I might have them come back and just give a booster treatment once a year or something like that, depending on what they need.
I asked you 5 years ago what you saw in the future, so I'm going to ask you again. What do you see for the future now? Where will this go from here?
Well, we already have the growth factors, and now we're working on more concentrated ways to get stem cells. And once we have that, we'll be able to do better transplants of the stem cells, growth factors together. So I think that we're already there in the future. Whether we're going to talk about regenerating new joints in a test tube and transplanting, I can't say that. But I think that as this technology gets better, maybe we'll actually be able to see some reversal of arthritis and things like that going on. I mean, there's a company out there that I've been watching that makes cartilage grafts, and the orthopedic surgeon, for example, someday soon will be able to do an arthroscopic procedure and just put on a whole new layer of cartilage, in one procedure.
I'm waiting for that one.
It's going to happen.
It's going to happen.
So we're all part of a piece of the puzzle. Disc replacement. We're working on technology now where we'll be able to repopulate the disc with a new nucleus and repair the annulus. So people that have herniated discs and degenerated discs will be able to repair the inside of the disc. So.
Listen, I thank
Dolly,
you.
thank you
so much.
Thank you.
Thank you for being
Thank you.
and caring and working with so many people. But this is a wonderful, wonderful little pamphlet, and they are available. It tells you all about PRP, and it's in very simple language, so anyone can understand it. And all you have to do is call the doctor's office, and he will send it out to you, and we'll scroll under his telephone number of his office. He is a wonderful guy and has done a lot for our family, so I thank him, and I thank all of you out there for watching all these years. Take care, and I'll see you soon.